doctors are telling them they're never going to be able to walk or crawl, or that's just, I don't accept that. I will go to the end of the world to find help for a lot of my patients in any way possible.
快来追踪我的脸书与 IG。
Hello, Jack. Long time no see. How are you?
What's up, Dr. Dirk? I'm good.
Great.
Thanks for coming.
Thank you for you to give me this opportunity to look over your clinic. And can you give us a clinic tour before we start the interview?
Sure. So, office here, we have a lot of independent contractors. So, there's me, 2 massage therapists, and 2 other chiropractors. There's some yoga classes that do doula. They have doula work for pregnant women. In here, we've got the kind of yoga studio / gym. This guy's got the size, a little bit of a mess, I guess, right now, but they do lots of kind of open air yoga, work with pregnant women or kids, or a little bit of everything in between.
That's
and
cool.
Then just kind of lobby space. We've got a chiropractor's room here.
Is this the place that you usually adjust the patient?
No, I am in the back.
Oh,
So
okay.
there's chiropractor there, a massage therapist here. We have an infrared sauna.
Nice.
This is kind of a meeting room where we have with some different things.
Mm-hmm.
And then finally, there's another massage room here. There's one going on, and this is my office.
Dr. Jake, I
Thank you.
appreciate that you give me this opportunity to come visit your clinic. And
Yeah.
can you briefly introduce yourself to our audience?
So like you said, my name is Dr. Jacob Boraas. Graduated with Dr. Dirk last year and was going through chiropractic school and found that I kind of wanted some more answers along the way. So I stumbled upon functional neurology. And the way you look at a patient is a lot different. My office is called the Functional Healing Institute and work a lot with kids.
What is your major technique that you're doing in this clinic?
So in functional neurology, you're using chiropractic more as a tool to stimulate the brain through afferent input that's coming into the brain. Kind of like if you're rehabbing a weak muscle, but we're looking at the brain, specifically how it's functioning, what areas of the brain we're looking to rehab and improve blood flow to. So it's usually one side versus the other to stimulate the opposite hemisphere of the brain. There's some random, just regular adjusting as well, kind of more of like a diversified classic chiropractic technique.
So what kind of the patient that you're seeing the most?
So I work a lot with infants, making sure that they're maturing properly, hitting their milestones, and if not, we input different stimulus to try and help the kid. I just had one that left who's a little bit older than he should be, for he's not walking yet. So we work on certain reflexes, help these kids kind of get through their barriers to fully mature properly. And then I also see kids that may have some different neurodevelopmental issues. So it can be sensory processing, attention deficit problems, it can be dyslexias or learning disabilities. It can be even bedwetting or anxiety, trouble sleeping. Really the gamut is very wide with different things that I see.
When you mention about neurology rehab, does that mean you will including some exercise like the physical therapist?
We start with, so I have a cold laser, so we do specific inputs to certain areas of the brain to improve blood flow. Then we do a lot of vibration therapies, because that's another great way to send afferent input, and then adjust the kid. And then we do, so a big thing is eye movements. So even just depending on if something's in the lower field or upper field, how the eyes are moving, if they're jumping. We can do even simple stuff like I'll grab a kid's hand and we're doing figure eights, stimulate same side cerebellum, and even different balance exercises, smells. I got colors therapies. We've got frequencies in the ears, and then a lot of primitive reflex work. That's the first step we go through, and then kind of from there it's more expansive depending on what the kid needs exactly.
Could you tell us about what's your chiropractic philosophy and what's your vision that you want to bring it to your patients?
My philosophy kind of, even before I learned so much about the brain, I don't think there's any condition or any problem that someone can have that can't be overcame, especially with these kids that doctors are telling them they're never gonna be able to walk or crawl. I don't accept that. I will go to the end of the world to find help for a lot of my patients in any way possible. I don't think there's any issue that can't be helped. Maybe not resolved, but definitely helped. I mean, a lot of docs I know across the nation that work in functional neurology have fully paraplegic people who learn to re-walk. It takes years and years of rehab. The brain is unbelievable in adapting and fixing itself. This is the spinal galant reflex.